Well, thank you, everyone. And as the recording has started, I'd like to welcome everybody to our webinar today, the first of the Reproductive Health Supplies Coalition's Compass series, this time focusing in on finance. And the title of our webinar today is Contraceptive Commodity Funding During the COVID-19 Pandemic, an analysis of funding trends and potential pandemic impacts in low and middle income countries. Then as we move to the next slide, I'd like to introduce myself, Martin Smith, the director of RHSC, and I'll be moderating today's webinar. Delighted to be joined by my colleagues, by Michelle Weinberger of Avenir Health, and two expert consultants who also contributed very heavily to this excellent report. Welcome to Kumbutso Dzeke, our colleague from Zambia, and Gillian Eva, our colleague based in the US. So I'll just say a few quick words by way of introduction. So 3 years ago, we barely need reminding of this, COVID-19 began sweeping across the globe, triggering the largest worldwide economic crisis in more than a century and tragically causing nearly 7 million deaths to date. And as lockdowns brought the world to a standstill, supply chains were heavily affected, in many cases compromised, and empty shelves were a continued threat from the supermarket to the health facility. Almost immediately, our RH supplies community sprung into action, from declaring essential sexual and reproductive health services to supply chain adaptations, including pre-positioning of stock, to advocating for reproductive health financing being protected. In 2021, the year after the pandemic started, RHSC and our colleagues at JSI launched a report concerning end-to-end supply chain impacts of the pandemic, and the link is in the chat now, that looked at health products across low and middle income countries. And we launched at that stage a community roadmap for action. Now then, the year after, in 2022, building on the analysis and the findings within that roadmap, RHSC introduced a new initiative called Compass, charting the way ahead, designed to navigate us through the uncertainties of the pandemic towards greater access to reproductive health supplies. And now the first report has been published under Compass. And again, thank you, Lucian, for the link that all participants can now see in the chat. Now, this report, which has been produced by Avenir Health, analyzes funding trends concerning potential pandemic impacts in those lower and middle income countries. And I look forward to hearing from Michelle, Kumbutso, and Gillian in just a few moments. But what really strikes us, I think, in cases where funding worsened, the report in many cases found that our community's resilience diminished and sometimes even reversed those negative impacts. We saw donors stepping in to fill funding gaps in many cases. When freight and shipping costs increased, it was largely our manufacturers who absorbed many of those increases. When shipping and deliveries fell behind, efforts were stepped up to resume our supply chain and the attendant services. And I think the report features fascinating insights, and Kumbutso's views on Zambia as one of the important case studies featured, I think really does bring us some fascinating perspectives indeed. And I do look forward to hearing from our three speakers today on those important lessons learned, and please do pay close attention to those recommendations for the future that come towards the end of today's webinar, which will last about an hour. We're 6 minutes in and we're nicely ahead of schedule. And please do keep those questions coming. We're going to have those questions coming within the chat. We'll aim to answer some of those organically as we go through the webinar. I will be collecting them all as your moderator and coming back to several of them in hopefully the 10 or 15 minutes we have available for questions and answers at the end of the webinar. So without further ado, as we move to the next slide, it's my great pleasure to introduce Michelle Weinberger of Avenir Health to give us an overview of the report and some insights into those quantitative findings. So over to you, Michelle. Thank you.
Great. Thank you so much, Martin, for that introduction and welcome. So myself and my colleagues are going to be walking you through some of the key findings from the report. I will start by talking about our analytical approach and summarizing some of the results from our quantitative analysis. Kambutso will be sharing insights from the qualitative case study that was conducted in Zambia, and then Jillian will share some reflections from the global qualitative work that took place as part of this report. And as Martin said, we hope to have a bit of time at the end for discussion and questions. So jumping into the approach, before we look at the impact of COVID-19 on contraceptive funding, it's useful to think about what we know about the context of funding before the COVID pandemic. There's a range of different sources contributing to funding of contraceptive commodities, including domestic governments and donors, with USAID and UNFPA really playing the largest role in terms of donor procurement of commodities, as well as private contributions, either coming directly from individuals or from institutions. Though for this work, our scope was primarily limited to focusing on the public sector, so that donor and government funding piece. We also know that lots of different factors influence funding, and that especially at the country level, year-on-year fluctuations are really the norm. So even before the pandemic, we saw that things were really going up and down over time for a range of different reasons, some of which are captured in the box on this slide. It's also important to note some context kind of pre-existing to the pandemic, and we know that many of the influences of the pandemic have sort of heightened this, but there's been a large focus on a reduction of reliance on donor funding and an increase in the role of domestic governments funding around contraceptives. And so these dynamics were sort of already in place and maybe exacerbated during the last couple of years with the pandemic. And it's something that we heard a lot about in our qualitative work. So just something important to keep in mind. All of this is to say is that the funding landscape is complicated. And so as we try to unpick what might have been a COVID impact versus something else, there's lots going on. And so we need to be careful about sort of how we think about our results and how we try to look at what may or may not be attributable to the pandemic within this landscape. So why might COVID have impacted funding for contraceptives? As we started this work, we developed this theoretical framework that kind of looked at 3 different domains to think about potential impacts. So the first are considerations related to the supply of products. So this could include slowdown in manufacturing or shipping delays, and these could impact funding in different ways. So if there are increasing costs, it might mean that there's the same amount spent, but it's buying less product. Or it might mean that there could have even been money available, but no product to buy. And so that money didn't actually translate into funding of commodities. Next are considerations related to accessibility of services and demand. So this could include things like more limited hours of operations in clinics, shifts in client preferences for how they interact with the healthcare system, or shifts in behaviors that might have changed underlying need and demand for contraceptives. All of these changes could influence what supplies are needed and therefore what funds are needed. And finally, there are broader contextual issues, such as funding being diverted to directly respond to the COVID-19 pandemic, or just wider economic shifts affecting how much money is available. And of course, these domains are interrelated as indicated by the arrows at the bottom. Our analysis is focusing on what changes we have seen during the pandemic and looking for some of the reasons behind them, though we're not able to equally cover all of the different domains shown on this framework. So how did we go about answering this question about the impact of COVID on funding for contraceptive commodities? First, we have a quantitative piece of analysis drawing on the 4 data sources that you see on this slide. With this data, we looked at aggregated trends, so across all countries, as well as country-level changes, with a focus on overall public funding, and then separately looking at donor and domestic funding. And I'll talk a little bit more about how we analyze this data on the next slide. We also complemented this quantitative work with qualitative work at both the global and country level. So we included a set of global stakeholder interviews to try to put some context and understanding to what we are seeing in the data, as well as 3 country case studies. And we're very excited to have Kumbuso here with us today to share results from Zambia, one of those 3 case studies. As with any analysis, our work has limitations, but we think that the findings provide valuable insights to our community and are useful to help further some discussions about what might lie ahead to make our supply chains even more resilient. So as noted earlier, there's a complicated funding dynamic happening. And so we didn't want to simply look at whether funding increased or decreased during the pandemic. So we came up with an approach where we looked at the trend in the years leading up to the pandemic compared to the trend during the pandemic period. The length of that period varied depending on data source of how many years of data we had to look at. And based on comparing these trends, we classified countries as either improving or worsening. Improving captures 3 situations: that funding was decreasing before COVID, but reversed and started increasing during the pandemic; that funding was decreasing before COVID, and that decrease continued, but slowed down. So it was an improvement in terms of the rate of decline; or that funding was increasing before COVID, and that increase accelerated. Worsening captures the reverse of these situations, and we had a few countries classified as having no or little change if none of these situations applied to them. So with that brief background, let's get into the quantitative results. I'll start by looking at overall public funding, and then we'll take a quick look at the disaggregated results for donors and domestic funding. This graph shows the aggregate picture of overall public sector funding for contraceptive commodities from 2 data sources, the FP Market Report in yellow and the RHVIS VAN in green. It is important to note that this overall picture is largely made up of donor funding. So we'll see some similarities as we look at this on the next slide when we start to look just at donor funding. At the aggregate, we don't see any substantial declines during the pandemic. We see a kind of leveling off within the RHVIS data and a little bit of an increase and then a little bit of a drop that sort of cancel each other out within the FP Market Report data. So a positive message that some of the fears that we worried about of potentially catastrophic drops in funding don't appear to have happened, at least at this aggregate. But it's important to note that these aggregate trends hide a lot of diversity of what happened at a country level. So these graphs provide a country-level summary of the changes within each data source. So on top, we have the data from the RHVIS VAN, and on the bottom, we have the data from the FP Market Report. The split between the blue graph and the red graph is the split between countries that were categorized as improving versus worsening. And then within each graph, you can see the distinction between the 3 categories that exist within each of those. So we can see that in both data sources, more than half of countries were classified as having a worsening trend. And the most common trend seen was an increase in funding before the pandemic, reversing to a decline during the pandemic. But it's helpful to note that the second most common pattern seen was the opposite of this, that darker blue color, which was countries seeing a decrease in funding, reverting to an increase during the pandemic. So while we did see a lot of countries seeing this worsening pattern, we also had quite a lot of countries seeing that opposite pattern as well. This map is showing us that same information, but here just looking at the geographic spread of these different patterns. We have more maps in the report. This is the only one we're going to look at today just because of time. But across all the different data sources, we generally saw that there were no clear geographic patterns of change, that within each region, we found countries with both improving and worsening trends, and that there didn't seem to be a lot of geographical explanation. So we didn't necessarily see that countries in certain areas of the world experienced more worsening trends or more improving trends than others. Because the overall picture is so heavily influenced by donor funding, it's not surprising that we see a similar graph when we look at the aggregate of donor funding. And we find, again, that at the aggregate, donor funding does not appear to have declined. While not shown on this graph, one interesting finding out of the report, and something that I think warrants more discussion and consideration, is which donors make up the funding that make up this trend line. There are 2 main donors, as I noted earlier, UNFPA and USAID that are the largest funders of commodities. Historically, they accounted for similar shares, so about 50% of commodities coming from each of those two donors. Starting in 2018, we've seen a shift in that, with USAID's contributions declining while UNFPA's contributions have increased. And if we look at those changes of that dynamic between the two donors, that doesn't really seem to be impacted by COVID-19. So the USAID money kind of continued to decline at a similar rate, and the UNFPA money continued to increase at a similar rate. And so we have this kind of extra layer happening behind the scenes of this overall change that I think has lots of interesting implications as we start to think more about the future. And we'll touch on that in some later slides. So here is that similar graph that we looked at before, but looking at just the donor funding. And again, we saw that the majority of countries, 55%, had that worsening trend. So even though at the aggregate, funding appears to have gone up a little, that just over half of countries were categorized as having a worsening trend in their funding at the country level. And finally, we'll look at domestic funding. For this, we have two data sources. The orange line shows us data on government allocation and spending collected by UNFPA and their priority countries. And the green lines show us domestic funding captured by the commodity security indicators, which is collected by the PSM project. This makes a distinction between funding that is generated by internal sources like tax revenue and funding that is coming from other sources such as basket funding or loans. And so that's why you see this data displayed two different ways on the graph. At the aggregate, we find that domestic funding has been relatively low and stagnant, and we don't really see any large impact of the pandemic. At the country level, again, we can see that, at least within the UNFPA data source, that the majority of countries seem to experience a worsening trend in domestic funding and domestic allocations. And looking at the contraceptive security indicators data, we see a slightly more optimistic view, whereas in this data set, slightly more countries, just over half of countries, showed an improving trend. This discrepancy between these two data sources can be due to a couple of different things. Most importantly is different countries are included in each of these data sets. So the CS indicators includes a wider set of countries that are included in the UNFPA, and there's not exact overlap of those countries within the UNFPA data set, but also differences in how this data is collected and analyzed. So this has been a very quick overview of the quantitative findings, but would encourage you to go to the full report for more details. And with that, I will pass over to my colleague Cambusto to get us started on hearing a bit about the Zambia case study.
Thank you, Michelle and Martin. So I'll take you through one case study, which was part of this study. Zambia was one of the countries, and there on the screen, what you see is basically some country context in relation to this study. So population about 20 million, that's from the last census, which was in 2022. Then economic-wise, at some point, at the beginning of this century, the first decade, Zambia was actually classified as a lower middle income, from a low middle income, but just recently the World Bank reclassified it to be a low income country. So not many resources available in the country for so many things. That's implication. I think contraceptive usage is just about 36%. So we might say that's not much, given that really almost all people who want to of reproductive age should be able to use contraceptives. But this has improved a lot from about 9% about 1992 to about 36% now. So quite some increasing trend, but there's still lots of unmet needs still up to now. Yeah, it's just 15%. It should be more. So there's a lot to do in advocacy for usage of contraceptives, in the sense that if you compare all adapt their meet need and actually how many are using, it doesn't come very much close to 100%. And then the COVID itself, which was what led to so many disruptions in the world. Martin mentioned empty shelves and all that. There's actually an index which was constructed to assess the extent of these disruptions. But here for this study, we're more interested in the stringency index. That's basically, in layman's language, is talking about the extent of lockdowns. That's what people basically refer to. So the stringency index was designed to see the extent in which so many things were stopped to function in a country because of a pandemic. So there were about 9 metrics used to calculate it. And the end result is a range from 1 to 100, with 100 being the highest. So the 9 metrics were school closures, for example, workplace closures, cancellation of public events, closures of public transport, stay-at-home requirements, international travel controls, and all that. So those basically now would have caused so many disruptions in activities. So going on to the contraceptive funding situation before COVID-19, generally in Zambia, what we found in the case study is that there's been some increase overall. So even the government of the Republic of Zambia has been increasing its funding for contraceptives. Generally, donors dominate this sector. Even now, they still dominate. But with advocacy, there's been push for countries to take more responsibility and see spending on contraceptives as an investment. So by 2017, the government had increased its allocation to contraceptives. And there's hope that actually that's a commitment they've made to the group of stakeholders in the country, that they'll be increasing by 1.5 million each year by 2020 and beyond. So the major donors are still UNFPA, and UNFPA handles these donations on behalf of a lot of other donors and also on behalf of one principal donor, which is the UK government Foreign Cooperation Development Office. So in fiscal year 2020, domestic funding accounted for only 14% of all contraceptive funding. And the trend there clearly shows the dominance of donor funding. But the good thing is generally there was an increase in funding towards contraceptive commodities. So if you look at 2015 there, and then going on to 2021, there's actually been a sharp increase, especially between 2019 and 2021. But if you look at government there, yeah, there was a kind of increase, then decline, and then picking about 2019, and then reduction between 2019 to 2021. And that's where now the impact of COVID actually comes in, since in the case study, it was pointed out that government had to divert a lot of resources from almost everything it was involved in, which was not so critical in relation to the threat posed by COVID. So the health budget was realigned to that intervention. That basically is what was given as the reason for this decline. Not necessarily that the government commitment is going back to the previous years, but COVID basically forced it to do that. Seems like the budget for the donors was more resilient or had already been allocated, and they couldn't easily make those adjustments. So there was a refocus on activities, and a good portion of money was allocated for unplanned COVID-19 programs. So I think 2020, that's how we saw that the number of programs financing was affected. COVID supplies, medicines were prioritized. So that's actually what the government officials gave us feedback and reason for that declining trend. So after COVID, it's expected that government funding will go back on the increasing trend. Another impact which would affected funding as well was an increase in costs. So this could have led to fewer contraceptives being shipped to the country. But what actually basically happened is that there was a diversion of funds, like by UNFPA, from other reproductive health activities to cover this increase in shipping costs. So the increase in shipping costs didn't seem to affect the delivery of contraceptives products into the country. And as you can see there, UNFPA has such a resilient program, and this is the biggest funder for contraceptives in the country, also the biggest procurement agent for contraceptives as well. They don't just fund, even when they fund, they are able to arrange for this procurement. So that resilience in the robustness in their procurement system, I think just ensured that contraceptives were shipped to Zambia even during the COVID pandemic, albeit that there were some slight delays in terms of timing of procurement as well as shipment. Yeah. And as mentioned by representatives, as you can see, the delays and the disruption of global supply chain were relatively short-lived as a result. The key things we learned from the case study in Zambia was that it's not just about COVID-19 affecting the contraceptives program of family planning. There should be so many other things which need to be improved. You will need to obviously build resilience for pandemics like COVID-19, but in order to be effective in delivery of contraceptives, there's a lot else that needs to be done. So what was brought to the fore was that the forecasting and monitoring of family planning commodities, as well as utilization, wasn't quite effective. The systems which were there just don't give you appropriate answers when you need them. Hence, you have some sites which probably had commodities in excess stock and some sites which were running out. So in responding to the epidemic, it was difficult to manage what was in the country so that there was effective supply of contraceptives all over the place in the light of the disruptions caused by shipment of contraceptives in the country. So solutions suggested for probably mitigating some of these impacts of the epidemic included regional manufacturing of contraceptives. Several stakeholders commented on the need to manufacture contraceptives within Africa or the region to lessen future global supply disruptions. It was mentioned most of these supplies were coming from, say, India, very far away. And when shipping lines just stopped shipping, there was that delay. And quite a number of supplies in the country had to be airlifted, like I mentioned in one of the previous slides. And then obviously, there's need for increased domestic funding for contraceptives. Stakeholders reflected on the need for the government to continue to increase its commitments and allocation of funds for contraceptives. And as pointed out in the graphic earlier on, that's still there, just that government had no choice but to divert the money. So hopefully this will continue in the coming years. Government will continue to increase funding to contraceptives. And in that line, there's been also a lot of advocacy done around reproductive health and contraceptives in general for all people in the country to see this as a good investment. And that way, there's lots of advocacy in the, for example, in the fiscal allocation for government, people are being trained and they speak in the media, present materials why this is a good investment. So the support here is that the support given here will definitely ensure that there's still a feeling by government to increase its allocation to contraceptives. Then the role of the private sector was brought to the poor during the pandemic. I mean, lots of disruptions in the public sector, which is the key sector, who are forecasting, for example, and monitoring family planning, leading to lots of disruptions. But as you've seen, like I mentioned, there's been a rapid increase in usage of contraceptives, and that just shows that more women, more families, more men are willing to manage their fertility. And if that's the case, it simply means if they don't find contraceptives cheaply at the public sector, they are ready to go and buy it somewhere else. So the private sector suddenly found itself playing a huge role when there were these disruptions. And many clients went to the private sector where there were fewer disruptions than the public sector. And then one other thing, final thing we learned, important one, was that there should be improvement in family planning services. Going along the lines of also improving forecasting, just improving family planning services as well would help us so much. There are services whereby you have to go very far to get, like those popular methods, implants. There are fewer people who are trained to deliver them. So with the disruptions where travel was restricted, specialists could not travel, little outreach could be done. Suddenly people found that they could not access those methods. So if provision is expanded for all methods across the board, it would help a lot. All right, yeah, so these were just what we got from the Zambia case study, but there are others from other countries which will be presented later by Eva. Thank you.
Thank you, Kumbuso. And yeah, as you said, a lot of what we found in the overall qualitative interviews mirrors what Kumbuso has presented for Zambia. There's certainly some consistent themes and messages throughout. So in this section, I'll be presenting the main findings from our interviews of stakeholders at the global and national level. Next slide, please. Thanks. So the overall take-home message from our interviews of stakeholders is that most of the early concerns about major and sustained supply chain disruptions and stockouts generally did not eventuate. Any disruptions that did happen were mostly quickly resolved. In terms of funding for contraceptives, as Michelle showed, it remained generally relatively stable. And this seems to be for two main reasons. The first was that funding was typically already committed when the pandemic hit, so at least through 2020. And second was that where funders did pull out or reduce their commitments, so most notably FCDO, other donors stepped in to fill those funding gaps. Of course, it is possible that we're not seeing an impact of COVID-19 on 2020 funding, since, as I said, much of this funding had already been allocated or even spent before COVID-19 began, and that if we look at data in subsequent years, we might see more of an impact. So the stakeholders' perception of the effect of COVID-19 on contraceptive funding matched the data that we analysed, namely that there was no major overall effect. But we heard that there were fluctuations in both directions from some donors. As I said, the biggest impact on donor funding in recent years was FCDO's reduction of their overseas aid in 2020 due to the pandemic's effects on the UK economy. And other donors did step in to fill this gap, but it did result in funding delays that led to some supply chain disruptions. Also, the donors who stepped in may or may not continue to maintain that increased level of funding long term. The reductions that were seen in individual countries, shown in Michelle's data, may be due to delays in UNFPA funding, as I said, caused by the FCDO cuts, rather than actual funding decreases. And again, future years of data would show that for us. We asked stakeholders whether they had seen any evidence of funding being diverted from contraceptive funding to tackle COVID-19. And there were some reports of this happening. UNFPA has some reports of it happening, as you heard from Kumbuso. There's evidence that it happened in Zambia, but it doesn't seem to have been a widespread issue. But the detailed information about government expenditure can be hard to access, so it may take some time for us to uncover what actually occurred. Thanks, Michelle. And a common theme among stakeholders was that there were many other things that affected contraceptive funding beyond COVID-19. And the stakeholder that we've quoted here listed several major events that were going on at the same time as the pandemic, including food security issues, climate-related disasters, conflicts, and then later on, of course, the war in Ukraine, which led to some shift in focus from some major donors. So as well as looking at how COVID-19 impacted specifically contraceptive funding, stakeholders also flagged that the pandemic obviously affected contraceptive services and access in several ways. So even though that wasn't the scope of this work, there's certainly some overlap between these impacts and the funding. Firstly, the increases in costs, particularly freight costs, which, as Martin mentioned at the beginning, were mostly absorbed by the manufacturers and donors, and were all somewhat mitigated by price and volume guarantees that were in place prior to the pandemic. Second was supply chain issues. There were significant delays in ordering and delivery of commodities, some cancelled purchase orders. Even if countries had the funding, they weren't always able to access the commodities that they needed. And this highlighted some weaknesses in the existing system, including poor supply chain management in some cases, a lack of agility in the supply chain, over-reliance or heavy reliance on a small number of manufacturers and donors, and again, reliance on manufacturing in 2 specific countries. And then finally, as both Martin and Kumbutso mentioned, the stakeholders mentioned that the SRH community did move very quickly to address the challenges posed by the pandemic. For example, to address the shifting needs of access and methods by introducing or scaling up approaches such as task sharing, mHealth, use of CHWs, and self-care methods. Based on our analysis of the data and our case studies in Kenya, Uganda, and Zambia, and our interviews with stakeholders, we identified 5 main risk areas to contraceptive funding during the COVID-19 pandemic. And for each risk area, we pulled out the ways in which the SRH sector exhibited resilience and also the lessons that we can take from the pandemic. So one risk to contraceptive funding of COVID-19, as we've mentioned, was donors and national governments diverting contraceptive funding to tackle the pandemic. Overall, this didn't really seem to bear out, primarily because of these pre-existing funding agreements that we've mentioned. But in the event that the impact of the pandemic had continued longer, these resilience factors would not have held true, which raises the question of whether there's an over-reliance on donor funding and a need to shift to alternatives such as domestic funding and national health insurance schemes where that's appropriate. The second risk area that was highlighted by the pandemic was whether donors would increase funding due to the effect of the pandemic on the global economy, which did happen with FCDO in particular. And as I said, other donors did step in to fill the gap in funding. And this really highlights the need for diversity in funding sources, and also for UNFPA to maintain some cushion funding so that contraceptive supplies are not disrupted if donors reduce their commitments in the future. As we noted earlier, the pandemic did lead to increase in costs, in particular for freight and shipping, although prices have reverted back in most cases. The pre-existing volume and price guarantees did mitigate the impact on countries, but it meant that the manufacturers, and in some cases the donors, absorbed these costs. And again, in the short term, that was manageable, but if these costs increased again and were sustained, then it would necessitate an increase in funding or a decrease in supplies. The way the current procurement system is set up is designed for large purchases from a small number of sources and may need to be adapted to be more flexible and to allow smaller direct ordering by domestic governments directly, so that in the case of future global events, costs wouldn't be affected quite so dramatically. Next slide. We did see shipping and delivery delays during the pandemic, but again, as with previous points, the supply chain reverted to normal quite quickly. And because many countries hold large stocks of commodities in country, there were actually few major stockouts were observed. But the pandemic did highlight the need for more accurate and transparent procurement and expenditure data, and for quality supply chain management, so that countries can be sure that they're receiving the supplies that they need when they need them. This would also allow the supply chains to be more flexible, to make quick adaptations when it's needed. But the SRH community's very rapid and nimble response to the pandemic did show that fast-tracking decisions without sacrificing quality is possible. And then finally, there were changes in both the amount and the type of contraceptives needed due to the changes in accessibility and demand, which Kumbutso referenced in his presentation. And this will have a knock-on effect on commodity funding needs as the method mix changes. And again, we saw the resilience of the SRH community in adopting or scaling up these innovative approaches. And obviously there was a plea from advocates that we spoke to that these would continue beyond the pandemic. So my last slide will be to present our two kind of quite clear recommendations that emerged from our work. The first is that the SRH sector, donors, governments need to prepare for this transition away from reliance on donors through domestic resource mobilization, national health insurance schemes, and a more strategic use of donor funding. But clearly, as we all know, more work is needed before that's possible. Some countries are not able or ready for this, and the contraceptive markets aren't currently designed for countries to be making small direct domestic procurement. And our second recommendation is the need to improve the forecasting and procurement processes through better understanding and use of data. More accurate, transparent, and timely forecasting and procurement processes are needed to enable strategic funding decisions, and investment is needed in human resources, systems, and infrastructure at the national level. The VAN is currently working on providing clear, timely, and quality data for all countries. So thank you, and I'll pass back to Michelle now.
Great, thanks Julian and Kumbutso for helping to share our findings. Just want to make a plug, if you have not looked at the full report, to go and look at that, as there's lots more there. And also just want to say a big thank you to all of those who contributed to the report, including the stakeholders across the 3 countries and globally who took time to share their knowledge and thoughts and expertise with us. I also just wanted to note that we are very excited that later this summer, we're going to be launching an online data annex that's going to allow access to the country level trends that are featured in the report. And as part of that, we're going to use it as an opportunity to update the analysis to include more recent data. So as Jillian noted, one of our limitations is we have some big lags in our data. And so our ability to really understand the impact of the pandemic is a bit limited when we don't have kind of more current data in that picture. And so as part of this update over the summer, we're going to be able to add additional year of data from both the RHVIS VAN data and from the FP market report. So give a more recent glimpse at what is happening at the country level.
Thanks so much. Thanks so much, Michelle. Thanks, Jillian. Thanks, Kumbutso. Absolutely perfectly on time, giving us full 15 minutes for Q&A and discussion. I think Olga and Doug asked this question. Yes, of course, we'll be making the recording as well as the the slide deck available, full report in the link, of course. And just going through the questions here, Chris has been particularly active, some super points, some very important discussion points here that we will go through as we look to other questions. Natalie, I also see your question that we'll get to also, as well as hearing from Michelle, Gillian and Kumbutso. In a few moments, I will bring in my colleague Sophia Hassan also to talk about other aspects of Compass that are in the pipeline. But let's get through some of these questions in order, colleagues, if that's okay. And so Chris's first point here, Kumbutso, you spoke to this a little bit in some sort of fund reduction diversion that we're seeing. Gillian, you picked up on this point, in fact, in seeing that there hasn't been sort of significant long-term effects here. But perhaps I'll come to you first, Gillian, then to Kumbutso on Chris's first point here around funds sort of being diverted, and whether we feel that this may then be a sort of a continuous trend in our landscape. Gillian, to you first.
Yeah, sure. Thank you, Martin. Thank you, Chris, for your questions. We anecdotally, people felt that there probably were a lot of funding diversion away from contraceptives to tackle the pandemic, of course. But when we kind of drilled down to find examples, we couldn't actually get hold of that many concrete examples of where that had happened. And a handful of stakeholders did tell us that they kind of explicitly had not seen it happen. I think our challenge is, as I said, we have the budget lines at the government level, but to get that actual expenditure and to see how budget lines changed takes a lot of time. So it may well be that we see more examples of that happening as we're able to look at the data over the next year or so. In terms of how, I think Kumbutso's probably a better place. No, I think Kumbutso might then be a better place to respond to how it will impact countries.
Super. Let's bring Kumbutso right in here. Thanks, Gillian, so much.
Yeah, in Zambia, this on there, I don't know if I can get that graphic again, pandemic impact on commodity financing. I'll be referring that to answer the question. Yeah, it should be slide number 21. Yes. Yeah, so that graphic, if you look at government expenditure, is clearly very strong, increasing upwards. Until 2019, bang, just when the pandemic is starting, it drops very sharply. So answers I got from government officials, UNFPA, who are the key stakeholders, was that no, government has been quite committed to increase this expenditure, and they've actually signed compact agreements with them, agreeing to take a shift of that expenditure from UNFPA. So that graphic actually clearly shows that there's been a sustained increase due to so many factors. The advocacy I mentioned, whereby the health officials were feeling finance officials were not appreciating investing in family planning, but that sustained advocacy has won a lot of people. It's being seen that it's essential to invest in family planning and contraceptives especially. So that drop, I think, to me is just a blip. It's clearly an example and illustration that COVID did hit, and suddenly people had to find resources. So after COVID, we should expect this to go back up again for government.
Thanks, Kumbutso. We'll move to our next question. Maybe Michelle, I can bring you in here, and this is pick up a couple of these simultaneously. The point on to the time lags between UNFPA tranche allocations, and also the point about sort of UNFPA bridge fund, which had been put in place, I think, back in 2017 to allow for commodities to be purchased ahead of the sort of final payment realization of donor funding. Your reflections on those couple of points, Michelle?
Yeah, Chris, I think these timing issues were a huge factor, and something we actually had many conversations with colleagues at UNFPA and RHSC on to think about how we were capturing them and how we talked about their impact. Because, like you said, even if funding levels didn't necessarily change because of these delays. There are commodities that potentially arrived later than they would have otherwise. For the two main data sources that we are using, so both the FP Market Report and RHSC VAN, they are counting the total value of commodities at the time that they arrive in countries. And so the time lag or those delays are picked up in terms of that money is sort of, that funding might have been counted in 2022 instead of 2021 if without these delays, those would have been delivered earlier. But we are sort of capturing all of what is spent. So the bridge funding is in there. The additional funding from other donors who stepped in is in there because we're sort of counting our funding based on commodities that actually ended up being ordered and being delivered to countries. I'd encourage people to go look in the annex of the report. We spent quite a lot of time trying to tease out some of these nuances between our different data sources around what they count and when they count it and how they count it, to help better understand, what is the story that each of these different data sources is telling us, because we have quite a lot of data in this space and that data doesn't always tell us the same thing. And some of that is because it's sort of capturing things in different ways. And so I've started to, in that annex, try to lay that out to help build that understanding about what we are seeing and what we aren't seeing. And I also do think that this update this summer that's going to let us pick up an extra year of data from these two sources will be really helpful to see sort of that knock-on effect of delays that might be continuing into 2022.
Thanks so much, Michelle. And so I'll Natalie, we see your question, and I'm going to take the opportunity to bring in my colleague Sophia Hassan here. Sophia is a senior technical officer in the RHSC Secretariat. It's been heavily involved in this report and has very much been instrumental, a lot of the brains behind our entire Compass initiative. So Sophia, in setting out parts 2 and 3 of Compass, you can also tackle Natalie's question, the aspect that we're taking on local manufacturing, what we know others are also investigating at the current time. So over to you, Sophia, if you're able to unmute. Thank you, Sophia. Great stuff.
Thank you, Martin. So along with this finance priority for the Compass Initiative, we have 2 other priority areas. One is regarding adaptations. The adaptations that were used within the pandemic period to secure supplies, to improve access to reproductive health supplies during the pandemic response period. And we'll have a report which will be issued in the coming months and we've contracted with In Supply Health for this. So we'll be looking forward to sharing that with everyone. Additionally, and this speaks to Natalie's question, our 3rd priority area is regarding the regionalization of supply chains, how to move towards having greater regional ownership and content of reproductive health supply chains in the future. And that includes greater regional manufacturing. Now, we do recognize that there are foundational pieces of work that are going on the continent. For example, the establishment of the African Medicines Agency, as well as the Continental Free Trade Agreement. All of these, along with a pharmaceutical technology foundation being established in Rwanda, all of these are pieces that will help lay the groundwork to support regional manufacturing in the future. And there are a great number of discussions and including donor-supported discussions and activities going on now. And that does include for reproductive health commodities, pleased to say. For the coalition, we are working with US Pharmacopoeia. US Pharmacopoeia will be they've actually begun a landscape analysis for us on the manufacturing capacity in sub-Saharan Africa for maternal health supplies. They're going to be estimating the current demand and the market size, laying that up against the manufacturing capacity to identify the key resources and gaps that need to be addressed in the future to establish a stronger base of manufacturing of maternal health supplies that are quality assured for the future.
Thank you.
Thanks.
Thanks so much, Sophia. Great stuff, Natalie. Hope that gets to your question. So a few more key points to pick up here. Again, good stuff from Chris. Some good questions around the way that implemented partners related to UNFPA were able to access commodities at country level, then those NGOs using their own funding. Michelle, insights from the data on those couple of points.
Yeah, so in theory, we should be capturing the money spent by those international NGOs procuring their own commodities, because the data sources we're using is capturing all of that, though our ability to have kind of detailed visibility into that is fairly limited. And so it might be something we're able to probe into a little bit more, especially in having conversations with those groups about what was procured. But those should be captured in the total. But again, Chris, as you rightly point out, right, that total donor funding staying constant doesn't necessarily, right, there might be dynamics in terms of how those funds are being spent happening between, are those products going to governments? Are those NGOs stepping up to buy those? Are there different things happening? And so I think at the country level, beyond the funding, there's a lot more to look at, right? So our first question to tackle was sort of, did funding drop? But I think there's a lot of other related questions that some of these additional Compass Initiative series are going to maybe help to give more insight and visibility to.
Thanks, Michelle. And then that point around what we're seeing in terms of how choice may have been affected here. I think that may well need to be a further sort of joint venture within our community, involving obviously a great deal of information we'll see coming through surveys, through DHS, PMA, service statistics and other sources to draw some conclusions over a long period of time as to whether those whether choice has been significantly affected. So thanks so much, everybody. And we're in the final minutes. And so I'm going to wrap things up here. And of course, thanking Michelle, Kumbutso, Gillian, Sophia, and the comms team at RHSC, including Lucian, profusely for the great webinar. Of course, things will be available, recording will be available. We also have this the prospect of this online annex with additional year of information that Michelle was referring to be available later on in the summer. And I think it's important to say that neither Compass nor the roadmap could have been developed without the insights and experience of the broader RH suppliers community and members of the Reproductive Health Suppliers Coalition. And we're going to continue to consult with our membership for your vital input as we embark upon RHSC's next strategy process. And we will have the RHSC general membership meeting in Accra in October. I was there last week to lay a lot of that groundwork, and I think it's a pretty safe bet that resilience in the face of COVID-19 and attendance analyses, including those under the Compass Initiative, are going to feature quite strongly in our GMM from October 16th to 20th. So sincere thanks, everyone. We brought that in just about on time, and we look forward to the next installment of Compass. Have a great day, everybody. Thank you.